So most of us care about or know somebody who has been impacted by substances. And we hope today to destigmatize substance use, to inspire hope, and to let you know that hope and help are available. Many of us use substances recreationally, whether it's to relax, to let loose, to cope, to manage pain. And sometimes substance use is a choice, and sometimes it, serves us well. But often, people struggle with substance use and it's no longer a choice. And there's nobody better at inspiring hope than JP. So, I was just thinking, can we talk about your story? Let's get into it.
Yeah. Well, welcome. And thank you for having us in this virtual type space. Perhaps a somewhat unconventional life, but a good one. And I think everybody tries to track back addiction and say, oh, there was the spot, right? Whether it's with, their family or this or that. And I don't think that's, addiction knows no boundaries like that. So I think I think my example will tell that as well. So, yeah, I was, I had a bit of an unconventional start. I was raised by my grandmother, who was an amazing lady. But not, I was always an entrepreneur, I guess, in my background, since I was like, I had a pet sitting service from when I was 9, and then just it never stopped from there on in. And ultimately, when I was 18, I co-founded a company called Northern Cards. And that ended up becoming Canada's largest greeting card company, and we sold our cards in 9,000 locations across North America. So it was a pretty successful thing, life was going pretty well for me. I had a big house in the country, and drove the Lexus, and I was a pretty arrogant guy, really, right? I was the shit, and and things, life happens. My grandmother ended up having a stroke at 90 years of age. So I put everything on hold in Toronto, and I moved back to my little hometown. And I spent the next 6 years living with her, taking care of her after she did that for me at the start of my life. So it was sort of apropos that I kind of returned the favor, and that's what I did, and I guess even that was it was definitely a challenge, to say the least, to bridge into being a caregiver. That wasn't that wasn't the type of person I really identified myself with in any way, but I still managed that 6 years, and that's sort of, I think that gets you up to when I was 35, I suppose. So is that a 35-year story in like under 4 minutes? Is that okay?
Perfect.
Okay.
So, and I have to tell the story about, so JP, there's nothing I can say that he can't one up. Anyways, we were talking one day. I have like 100 examples, but we were talking one day, and I told him that I had loved VW, Volkswagen, Beetles, and I had a toy car collection when I was a teenager. And I did my babysitting service and bought my toy cars. And then he sends back a picture of him with the new car he had bought as a teenager, a VW Beetle. So it's just kind of the nature of our relationship. I was collecting toy cars. He was buying real cars at the same stage in life. So things were going well for you. And what happened?
Well, then, I always like to quote Mike Tyson here, right? Everyone has a plan until they get punched in the face. And isn't that really the truth, right? And if you look back to not every addiction story, not everyone's kind of trigger or into deeper addiction is certified by the proverbial punch in the face, but a lot of them are, right? A lot of them we can track back to something that happened, right? And that could be a divorce, it could be a death in the family, it could be a loss of a job, it could be all these different things. And in my case, it was a pretty profound punch in the face. I got arrested. And there you go. That's that beautiful mugshot there. a pointer for people that are about to get arrested. Make sure you wear a goatee or some facial hair that you never ever wear any other day on the day you're getting arrested, because it makes identifying you later on a little bit more challenging for law enforcement. But yes, that was the one day I wore a goatee. I was arrested, and it was a pretty profound event for me, and it's it's I guess it didn't help that my we had 100 people working for me at the greeting card company at that point. It's a very family friendly. I guess think about maybe your guys' industry, right? You guys got to be pretty squeaky clean, right? I mean, everybody wants, if you're going to make an investment, you want to make an investment into a company that's not run by a guy that looks like that. And same thing with greeting cards. So we were selling mostly into Western Canada at the time, and conservative USA. So the thought of having a guy running this brand that was had 29 criminal charges was really an untenable thing. And when I say I got arrested, I really got arrested. So I went from being arrested to getting myself on Canada's most wanted list. So because I didn't deal with my problems, they decided to really profile me. And if you go to the next screen there, you're going to see, so that was the first time I saw that was my picture on the subway. And so yeah, that was a pretty big fall from grace. In kind of every sense of the word, it was it was a very difficult problem to deal with, and I didn't deal with it, and that was it was tough, and I faced a lot of consequences from that, yeah, it was tough.
And how did you cope?
I did a lot of drugs. So at that point in my life, kind of backing up a little bit there, I'd used drugs occasionally, maybe I'd say one weekend a month up until when I had to take care of my grandmother. And then things escalated downward from there on in. But when this happened, drugs were something that allowed me to forget about what I was dealing with, right? To sort of put this awful experience away in a box somewhere for a period of time. And that old metaphor of drowning your sorrows, I guess, in a bar, we hear that all the time, and I think that's very true. And I think for me, it allowed me to forget. Like, it allowed me to forget, like, oh my God, what had happened to my life? I was king of the world not that long ago, and now I'm in the gutter. I mean, this is literally worse than the gutter, right? I mean, there's some dignity in the gutter compared to being this. You are the worst. Look, all I did is write greeting cards for a living at this point. I mean, I hadn't even more than a speeding ticket. It was all my criminal entanglement, and now I'm in the top. Fortunately, I guess I'm on the bottom 12, the bottom 12th there. I don't know if they go in order of severity, but it was tough, right? It was I didn't know who that person was, because I'd had this life that everybody looked up to me, and all the staff in my company came over to my house for a Christmas party every year. I was going to kids' graduations, and I was I was the guy.
You were hosting baby showers.
I was hosting
You've given me tips on baby showers.
Right. I was hosting. I didn't go to them, but baby showers for my staff were hosted in my house because I had a great pool, and now I'm on the run. Like, what had possibly happened? And yeah, it was tough. It was really tough.
Yeah. So this is the point in the story where I'm usually in shock, but as we were, as I was thinking about this recently, I was in shock, but I wasn't, right? Because working in the field of substance use, I see a lot of wrongful criminalization, a lot of injustice. We know our justice system in Canada and North America, at least, is very unjust. And we see that people get trapped in a cycle of criminalization and charges and isolation and hiding. Sometimes for nothing, sometimes for very small things, sometimes they build up. So I do actually see a lot of people, maybe who don't have your story, but who follow, some similar trajectory. And so what you've described is that, things became very stressful or like incredibly stressful, and you use substances to cope. And I think that's what we see among many or most people who use substances in a way that where they've lost control. So people who struggle with addiction, we know there's often underlying trauma, grief, physical pain, unmet mental health needs, social anxiety. There's often, many of those together, and people use substances to cope, and then it creates a very vicious cycle. And depending on the substance, you get physical dependence. Your brain and your body become physically dependent, and when you try to stop using, you have withdrawal. So you're physically unwell, and the only thing to stop that is to use the substance again, apart from medical treatment, which is very difficult to access, especially if you're on a most wanted list. But for most people actually struggling with substance use. And so it creates this cycle that can be kind of impossible to get out of.
Yes.
And perpetuates itself.
It does. And I mean, that's why Stigma is sort of like my baseline go-to in all the education that I do, because I see it even we like to say how much better we've become, but we have so far more to go as far as treating people with dignity and treating people, in a humane way. Because even if you think about how we would treat someone in an emergency room today, I mean, if they're unwelcome there, if they feel that they feel like they are a burden to the system, or that they're just treated in an inequitable way, I mean, it's not something you can fake. People feel it, right? And so if you're coming in for an injury of any sort and you need to have follow-up, and the emergency room is the only place you can get that follow-up, what are you going to do? If you were treated badly, would you go back there, or would you just sit at home and say, okay, hopefully it'll get better on its own? And, the human body isn't such that it typically does get better on its own, right? We need medical interventions for most of the things that ail us, right? And there is medical interventions that help. And, the saddest part is that, in my case, it was pretty profound, the amount of avoidance that I did for care, but the end result is the same, whether it's a, infected toe that you don't get cared for, which can become septic and, it take over your whole body and kill you. And if you're not feeling welcome in some place, and especially if there's some level of, impaired judgment sometimes about, and the substance allows us to do a level of avoidance, it can lead to death. And so we do our very best in all our teachings to show people, to treat people like they would want to be treated, right? I mean, it seems very common sense, but it isn't.
Yeah, we shouldn't have to say it, but
we shouldn't have to say it.
Yeah, but you're talking about the consequences of substance use, and when we're supporting people with addiction, often we're helping manage and address the consequences of substance use as well, and it takes us back to the consequences. Just reminded me, we talk about the 4 C's of addiction. So if somebody's watching this, I mean, it's pretty obvious when you're using drugs every day that there's an addiction and a substance use disorder. But if, somebody's wondering, has my substance use become a problem? Is this an addiction?
Yes.
We talk about the 4 C's. So cravings to use, constant desire, urges to use, compulsion to use, taking actions, loss of control. So it's that loss of control, I think, that really defines addiction, and then consequences of use. So the fact that people continue to use despite the fact that there's these health consequences or social consequences, work consequences, that is kind of how we define or diagnose addiction. So for you, tell us about, going back to the healthcare system,
Sure.
What were the consequences for you?
Well, the consequences were pretty profound. They and complete. So by the time I was got on that list and saw myself on the subway, I had switched to just using drugs IV. I was injecting crystal meth every day for a period of about 7 years. And I faced the consequences for every possible consequence you could get. I had an infected heart valve, which required a major surgery. I contracted HIV during that process. During that time, by the time I was through that, I'd been in the ICU 8 different times, and I, I guess I'd anything that could have gone wrong did go wrong, short of my life and death. That picture is taken in the last time I was at the ICU, I had to, I did an interview for our national broadcaster a few months ago, or maybe it was last year, and they said, "Oh, don't you have any selfies of when you were in the hospital? I think that would help with some authenticity." And I'm like, well, you obviously didn't hear my story, because I mean, most people that are on the most wanted list aren't taking selfies all the time, but and putting them on social media. But beyond that, if someone's in the ICU, they are rarely well enough to take a selfie, right? That's not in the, not in our healthcare anyway. And so somehow I managed to find that one, and yeah, so that's what I look like in the ICU.
And you were fairly alone by this point, right? Navigating.
I was very alone in the whole time. I guess I couldn't say everybody turned their back on me, but maybe I just perceived that they would. I didn't reach out to everybody. But yes, I was very alone. I had no family. I had no friends that I reached out to. Being mindful that when you're on the most wanted list, there's always an opportunity to drag somebody into your situation. Like if you were, if I went to a friend and they gave me $5, I didn't need $5. I was smart enough with my money, that I was able to manage things better than that. But there could be charged with a crime themselves. And the last thing I wanted to do was drag somebody even further into the shame of what I was dealing with by having to help me, right? I mean, I couldn't even deal with the guilt of dragging.
But this is impossible. Like, it's impossible to navigate our healthcare system these days. It's very difficult to navigate with resources and support. And so you would have been coming out of the ICU needing IV antibiotics and wound care and home care, and you didn't have a home to arrange that in.
It was awful. I mean, you got this situation. I mean, in our healthcare, so I mean, with the heart infection that I had, it requires IV antibiotics, as Katie mentioned, and so a nurse would come in and say, okay, so we're going to be, we're going to send the nurse to your house twice a day. And I see your address is, blah, blah, blah. And I'm like, yeah, that's where I'm at. And I didn't have the heart to tell them I don't have an address right now, because it was too embarrassing, so I sent them to my old address that I used to have. And I'm sure that my old people that own the house were pretty not happy about having these knocks on the door from these random nurses. But so I never got the care. And then I got sick again, and got back into the ICU, and that sort of thing would happen repeatedly.
I think it just, we hear a lot, we hear in the hospitals and we hear in social networks, so-and-so is not helping themselves. So-and-so is not taking care of themselves. And, but I do reflect on that, because it was quite literally impossible for you to take care of yourself in this circumstance. And we see many people, so many of my patients don't really have the choice to, follow the recommended medical advice, or even access to the recommended medical advice due to lack of phone, or lack of address, or, mental health barriers to.
It's so real. I mean, yeah, it's not even as, us with such experience that we would have trouble navigating if we were well. And so for folks that are not well, not necessarily always thinking best, and then add a layer of substance use on top of it, which is clouding judgment, right? I think, there's different schools of thought on that, but I think it's fair to say it doesn't help.
At least in some moments.
In some moments, definitely.
Or in all moments, but in
most moments. Yeah. I'm going to go with most moments for me. For me, in other cases, it's not, right. Not all substance use will impair judgment, but I've never heard it. Let me put it another way. It doesn't help. It doesn't give you this superpower, in spite of what a lot of folks, that including myself, would have told you while I was in the depths of it. Well, I can concentrate on something better than, and I could drill down on things that may not have been that important, but with a finite detail that I couldn't do otherwise.
But and I think the point is that there wasn't a lot of choice. There was not, at this point, there was not a lot of choice.
There wasn't a lot of choice. It was where I was at, and I was this I was going to be there for the rest of my life. There was no point in that journey where I said, oh, I'm going to stop at some point. I knew this was where I was at. I wasn't scared of death, but I at all, actually. But this was what was going to kill me. You can't be in an ICU without knowing that's what's going to kill you, and it's just a matter of where and when. Yeah. So emotions, right? I mean, this is all of it, right? This is what we've been talking about. It's all this, right? It's regret, it's shame, embarrassment, fear, humiliation. These are the things that are governing the journey and governing, from my case, my ability to reach out for care. And I see it every day in the emergency room where people are resistant. I see people waiting in the ambulance bay trying to get enough courage to come in and try to bring them in. And, I know they're profoundly unwell, but they'd rather just get close enough to the emergency room, like they think that's going to heal them, or just get up enough courage. And it's heartbreaking, right? Because that was me, right? And in my case, I never walked into the emergency room voluntarily. It was always by ambulance, because it was either I called or somebody called or something happened. And because I wouldn't voluntarily, I wasn't brave enough to walk in. I wasn't brave enough because it was either, I either thought I was going to get arrested again, because I never knew the link between criminal justice and I didn't, and there's always police in the emergency room and, all these different things.
So now, before we negatively impact everybody's mental health with this tragic story, which it really is, right? I'm always at a loss of words at this point. But there's hope in the story.
There is hope in this story.
Let's go to Joy.
Yeah. So let me tell you about Joy. So Joy was the person that changed it all. So Joy is now if there's any Simpsons fans out there, Joy is reminded me of Selma. And in many ways, from The Simpsons, she was a harm reduction worker that came into my ICU, and probably within one day of me taking that picture that you just saw a few screens ago, and she came up to me, and now a lot of people have come up to me at this point trying to offer help, and I pushed every person away, but Joy kind of was a standout in this, right? And why was she a standout? Well, one of the things she was a standout by is that she didn't look like anybody else, and she's just like one of these very tell it like it is kind of people. She when I was a kid, I did see my dad a few times as a child, and he ran some taverns in a city near where I grew up, and I used to when he had me, he just sat me at one of the taverns, and I used to. I was like 8 years old and being cared for by these ladies that just sat there, presumably it seemed during the day, and drank beer, and but they were taking care of me, and it just very not the pretty profane, but they told it exactly like it is. They were straight talking. It's like, stay away from him, stay away from him. Like, it was just sort of this tell it like it is kind of thing. And they reminded me of, it was a good memory. It was actually a good memory, believe it or not. And that reminded me of Joy. So Joy was this very plain spoken person. And I remember that conversation so well that, where she said, look, I've been through your chart, and I see you've been in the ICU, 8 different times. And she said, I've never seen anybody that's been here 9 times. And she just sort of let that float out there a little bit. I'm like processing this. And like I said, I wasn't afraid I was going to die, but it wasn't a unique delivery that she gave. And then she followed it up with, will you let me help you? And just left it there in the air, right? She didn't say what the help was. She didn't even say what she was or what she did. But there was just this, I think sometimes we call it like an epiphany moment, right? Where it was like, I was thinking, right? I didn't have an answer for her right away. And then I said, yes, I will. And it was just at that moment where you realize that, okay, I'm 7 years into this, right? I've been in total control of this ship that you could say had been running aground for a long time, right? But just that weight off my shoulders that she couldn't F it up any worse than I've F'd it up at this point. So why not? Why not give it to somebody else? And it was like this I remember, I don't think I'd cried once in this journey, but at that point in the hospital, I cried. And because it was just this, I don't know, it was just, I can't explain it. I can remember it like it was yesterday. And, but yeah, and that's, and boy, did she help. Did she help? She got me a place to stay. She got me a family doctor. She got me, I'd already spent about $250,000 on lawyers at this point. But she got me legal aid, which wasn't about lawyers. Legal aid is a subsidized program, which typically we would think would be the crummy lawyers. Um, by the way, that's a big myth. It's not the crummy lawyers. It's actually the lawyers that care. Um, and So this lawyer, was able to was able to go through this stuff and my case, and he said, "Oh, I said, I've got this affidavit that the charges, the drugs that I was caught with, or that allegedly caught with, weren't mine, and somebody else taken responsibility for them. Here's a sworn affidavit that was sworn." He's like, "What? What? You got what?" And I said, "Well, it doesn't matter. The lawyers have seen it. Said it's useless." "What do you mean it's useless?" I'm like, "No, it don't even bother with it. I'm just showing you the whole package." And he said, "No, no, no, no. That's everything. That's the whole case." And it was kind of just like that. Just like that. He was able to present it to the Crown and the judges, and the justice wheels move very slow. But just like that, all 29 of my charges were dropped. Like it didn't happen. Like it was just wiped out, just like that, right? Just like that. And and it was over. Effectively, it was over. I mean, and it was just left to pick up the pieces. And wow, what a so it and these are some of the organizations along the way that helped me. Unity Health, where I work today, Fife House is where Joy worked. Amazing organization that, as I said, I was fortunate enough to just finish being the president of that organization. I'm the past president now, and CAMH is another organization that I've worked for 8 years, and Loft is the organization that provided the housing that I lived in. And yeah, it's it's been just like that, right? Putting those pieces together really pulled it together.
So there's always so much in what you say.
Yeah,
so much to respond to.
Big story to unwrap there.
But I think what stands out to me about Joy, you talk about her help being non-judgment, caring, compassionate, non-judgmental, non-coercive. So that stands out. For a long time, I have said to patients, often who've tried to access help and haven't been able to access help and have been rejected in the health system over and over, I say, I want to help you. And that has always felt meaningful. That's kind of a point of connection with patients. I want to help you. But hearing your story and seeing this now, it's not the first time, but it stands out to me that she said, will you let me help you? And I think that's a message for family and friends too, because people, when they're using substances, have often been told by many people, you should stop, you should do this, you should do that. All these things you should do that actually might not be possible at all in the moment. And so she was actually giving you autonomy and choice. She was telling you what to do. She was saying, will you let me help you? She was expressing care. She was expressing desire to help and waiting for an invitation. And I think that for you and I think for many people, it sounds like that was really pivotal. And she also attended to your basic needs because, if your basic needs aren't met, you can't address anything else. Right. Basic needs like hunger and housing and sleeping somewhere safe. And so really what she did was harm reduction. That's what we do a lot of work in harm reduction now, but that is the definition, what you describe, which you didn't know what harm reduction was at the time. I did
not know what that word was.
But that is the definition of harm reduction.
Yes.
And so I think that's it's an important example of what harm reduction really is.
Yes. It is, and it's one of these things, like I describe harm reduction as a bit of a stealth program. Because if she came in and said, would you like to join our harm reduction program? I would have told her, bye-bye. I would have left. I wouldn't join any program. I'm not signing up for anything, right? But you got to do it in a way that's, very patient-centered and very much person-centered and very much respecting that person's autonomy, right? And I think that's key. And I still was in control, as you said, right? She still said, "Will you let me help you?" Right? So it was still my ship at that point, and it had to be, right? And then slowly but surely, I started to trust, and trust I did, right? So she said, once all these charges were dropped, it's like, well, now what? Now what am I going to do with my life, right? And then she said, well, you could, go back to school. You could do this. We have a peer program where you could learn how to help other people. I'm like, oh, I don't think I'd be very good at that. I'm not a very helpful person. I'm not a very kind person, and I'm certainly not that type of person. But I got to tell you, my debt to this woman was, immeasurable. So whatever Joy suggested at this point, okay, let's do it. And I did it, and that's what allowed me to, get back into, being able to, communicate and walk upright, as I say, because you lose all those things when you're, you lose your ability to navigate things. And certainly, working in a workplace is a challenge. I mean, it's a challenge for all of us now, with the best of the best of intentions and the best of educations and the best of training and exposures. But for someone who has lived that life that I had for that decade, it is a particular challenge to get back into that. But that allowed me to do that, and that allowed me to get back into addiction care, or get into addiction care, and go back to school to study that. And it was. Thank God for Joy.
I think what you also describe is, yes, thank God for Joy, because you're here.
Yes.
But what you describe also is the social determinants of health,
Yes.
needing to be in place to address your medical
100%.
issues. And
Yeah.
we know, and it's not a nice concept. It's a evidence-based,
Yes.
research-based concept. Like, there is a lot of research and literature on social determinants being, key drivers of health. I think they're responsible. Studies show that social determinants can be responsible for up to 50% of one's health or wellness, which is actually an even bigger proportion than genetics, for instance, or lifestyle choices, 100%. Or any of these other things. So social determinants of health are important, and that's things like housing, food security.
It's like a family doctor that won't take someone who's homeless, right? So, I mean, that would be a big barrier to care, right? That wouldn't be a good thing, right?
There are a lot of barriers.
There are a lot of barriers to
people
care,
who are
right?
unhoused. Yeah.
Yeah, I don't want to take patients, or I won't give psychiatric care or mental health care to someone who's got an addiction disorder. You take care of that addiction first, and then you come back to us, and we'll give you care.
Mm-hmm.
But a great thing.
It's even beyond the denial of health care, and just like the inherent, for instance, income and food insecurity, these factors, then you're having to eat, more highly processed foods. You're in kind of hunger states, adrenaline states, the cortisol rise that you have when you're in a constant state of survival. So, and my colleague and I were talking about it, how it's expensive to be poor. So the less you have, the more difficult everything is. The more resources you have, things come to you. You get free bonuses, you get free giveaways, a friend is giving away something that's nearly brand new. And it has real physiologic effects. I think that's the point. The deprivation has real physiologic effects. That makes it a cycle very, very difficult to break free. And on top of that, what you describe is difficulty accessing healthcare, and the shame. So we're glad you're here.
Yeah, me too.
Yeah,
me too.
so
Much better than the alternative. So this is, and I guess this is, Katie and I have gone back and forth about this slide and training and things like that. But I don't know that we have the exact same philosophy on it. But I do believe that I would have been able to navigate the situation better without substances, in a way, right? I think that it does impair our ability to process things in a holistic kind of way. I think we get. I think there is an ability to overfocus. Certainly in the drugs that I did, and in my experience at least. You get this ability to over-focus on something or hyper-focus on something, and it might not be the right thing. And, there's so many different aspects to my case that, I just don't think I had that sound judgment about myself. So yes, I guess so there's no problem so big that drugs and alcohol can't make worse. And I think my problem was big enough, and I made it worse with drugs. That's the end. That's the moral of my story, anyway.
I don't disagree with you. I don't think substances necessarily help decision making, and they definitely impact it. But when you tell your story, if you can't blame or you've put a lot of responsibility on the substances for your difficulty managing, but it actually sounds like you managed many things quite well. Like you navigated, well, you still have photos from that time period, right? And all your records, and you navigated the legal system. You hired actually multiple lawyers and then navigated the legal aid system. So I think that part of the problem you were facing was discrimination and stigmatization,
Definitely.
right? Because you had the affidavit and you hired and paid a lawyer. That's a pretty complex task, and still you didn't get the outcome you needed. And it wasn't necessarily only to do with substances. It was, or not to do with your impaired judgment. It was because you were using substances, people didn't believe you.
That's true. So, I mean, it may be, depending on how you look at it, if the drugs are making it worse because of the stigma associated with the drugs, that could be part of it. But in that way, it certainly was, right? Because nobody wants to navigate that. Now, this is a, we have a takeaway message for this whole thing. I mean, we know when someone goes to prison and they get separated out from their substances for, let's say, 60 days, they just don't do drugs. Well, then everything's better, right? They're not going to use drugs when they get out, right? Will they? Probably. Yeah. And why is that? Because whatever drove them to use the substances on the day they went in, it didn't change. It may have gotten worse even, right? And I think that's
definitely got worse.
Almost definitely got worse. And I think that, that's why these two things have to be done at the same time. We have to work on ourselves. We have to work on our problems. We have to work on the underlying traumas that may have triggered that, function of use, as we call it. What's the function of use of a drug? And, what has it caused it? Because it's not going to just go away when the substances aren't. And you'll see in my story, I worked on everything together and that's why I've been, very fortunate and I don't say I'm never going to use drugs again. I just say I'm not going to use today. That's the way I structure it, and other people frame it differently. But I haven't, and I've strung together about 10 years of those days. So I'm very, very, very happy about that. But again, it's not forever. Forever is a long time. So.
We've talked a lot about the work, the social determinants of health, the work you had to do to rebuild your life.
Yep.
And the quote here was, wellness takes root when people feel they have more to live for than to escape from. And so that's what you've described as you rebuilding your life and finding wellness. And then there are treatments, and you didn't access actually as many addiction or substance use treatments, but they exist, and many people do require that.
Yes.
And that's what we do in our professional jobs every day. And so, we wanted to paint the landscape of that a bit so people know what might be out there. Obviously, it's different by region, by country, but there's probably a lot of overlapping approaches. And we have, people who seek help for substance use, there's different stages. So I consider the first stage is helping people be safe. So reducing or making their use safer if somebody's injecting, using clean needles. If somebody uses opioids, having the reversal agent naloxone, which in at least North America is very widely available. So kind of the first step is helping people be safe and starting to address those underlying social needs. And then the next step, or if somebody wants to stop, is we want to make sure it's safe to stop. So there are a few substances like alcohol, benzodiazepines like Valium or barbiturates that you can't just stop abruptly. They're all uncomfortable to stop. You'll have withdrawal if you're physically dependent on any substances, but there's a few that are dangerous to stop abruptly. So especially alcohol, it's a good one to know, needs to be tapered, or it needs, somebody who's drinking 10 drinks a day should probably drink only 9 drinks a day the next week and 8 the next week. Or have medically assisted withdrawal. Right. So
there is assistance for that, and for helping loved ones and stuff like that. I think there's always help to ask questions about what's out there, and it's best not to do it alone, right? Because I think I'm the poster child for going alone doesn't always work, and to reach out. And you're right, I never got that care because I also, in a way, I still. I saw it as, I wasn't brave enough to get that care, right? Because you got to be in a pretty vulnerable position, and I'm not used to being vulnerable, and that's so it's tough, and I get that, and I say that to, I used to work in an addiction clinic in the hospital before I worked in the emergency room, and I used to always say, it's. I'm really proud of you for coming here. And at that point I did share more about my lived experiences. I wasn't brave enough to come here. I couldn't come up that elevator and stand in line and say, I'm here for addiction, and then have someone ask me what I'm addicted to in a line and stuff. I would have just run away. And so I know what it takes to get there, and there should be no shame in it, but I get it, right? I get it because I felt the shame myself, and so yeah.
Yeah, it takes a lot. That's the biggest hill to climb is asking for help and walking in the door.
Yes.
And I guess the last point I wanted to make on treatment, we talked about keeping people safe or helping people keep themselves safe. We talked about, withdrawal and the risks of that. And then the last thing is, what does treatment look like? And, I say there's using multiple approaches at once probably works best, but some people take one or the other. So there's the psychosocial treatment, so things like counseling or residential treatment, groups. There's things like Smart Recovery or AA, NA. Those are kind of all different types of groups available internationally.
Low barrier. They're available virtually,
online,
and anonymously in a lot of cases, where you're not even having to show your face in some cases.
In meetings. So there's those approaches, and then there's also medication. And medication we always target, we treat the underlying drivers of substance use. So if somebody has ADHD or has anxiety and it's never been treated for 30 years, at some point treating it will help medicate the underlying cause, and they won't need to self-medicate. And then there's craving meds for many, many different substances now, but especially for, opioids and even for alcohol. We know there's very protective meds that can help reduce cravings and
100%
and reduce use. So, okay. Well, thank you. Thank you so much for sharing your story. I have heard it many times, and I take more from it every time. I continue to learn from you, and it's inspiring and difficult to hear. So thank you.
Hopefully people can take something away from it that is useful, right? And I know parts of it can be dark, but I hope that the hope comes through, right?
Parts of it are quite bright,
and
right?
Parts of it are quite bright, and so I don't like bringing people down with it, but it did end up quite good. So if for no other reason, when I do these talks, if people can just see the value in treating people with dignity and treating people with respect, then and seeing that not all these stories that look dark continue into a dark path, and sometimes it comes around and it has a happy ending. So this is a happy ending, and thank you for being here today.
Yeah,
okay.
Thank you.
Thank you.